So good afternoon, and welcome to the first in a series of inspiration webinars, where we will hear from peer support specialists, supervisors, and program directors about what has inspired them in their roles. My name is Rita Cronise, and I'm the co-director of the Peer Support Services Technical Assistance Center, known as PeerTAC. I come to this position with a lifetime of personal experience with learning to manage my own mental health issues, and over 25 years of experience in leading and training peer specialists in mutual peer support. I'm really excited to be to be the moderator for today's panel discussion. And as we get started, I'd really like it if all of you that have joined us could go ahead and introduce yourself. Let us know who you are and where you're located in the chat. So today's webinar is the first in a series of 3 webinars that we're planning this summer about what inspired people who were once receiving services to become peer specialists. And we'll also hear from people who are in the roles that support the peer specialists, like the supervisors, the trainers, or the program directors. This particular webinar is focused on the adult system of care. In the next webinars in the series, we'll hear from people who were in the child system that were inspired to become family peer advocates, or those who were in the transition from child to adult who have become youth peer advocates, as well as the roles that support those positions. So Angelique, if you would be so kind, we're going to launch a poll so you can let us know your primary role, whether you're a clinic leader or manager, a non-peer provider, a supervisor, a peer support specialist, or an advocate, or something else. And while you're doing that, I'm going to tell you a little bit more about PeerTAC. So PeerTAC was established to provide training, technical assistance, and ongoing support to mental health organizations in the successful inclusion of peer support services across the lifespan. So what do we mean by the lifespan? Well, that's really about providing services for children, for youth, for adults, and older adults. And we promote services in the mental health system that are done by qualified New York peer support specialists, NYCPS, credentialed family peer advocates, or FPA, C, that's the credentialing, and credentialed youth peer advocates, or YPAC. Our center is funded through the New York State Office of Mental Health, so our technical assistance is really not connected with the Office of Addiction Services and Supports, known as OASIS, which also recognizes a parallel certification program that provides peer recovery support for people with addictions. Now, we know that peer support can bring hope and a sense of healing to people who have experienced adversity due to mental health challenges. And our vision is for all people, regardless of age, race, socioeconomic status, stigma, or other factors that get in the way of recovery and healing, to have the option to receive peer support services. PeerTAC is a partnership between the Academy of Peer Services at Rutgers University and the McSilver Institute at New York University. The Academy hosts the training and testing for the Adult Peer Specialist certification, and New York University McSilver hosts the credential for the family and youth peer advocates. So I'll stop for now, and let's see who we've got in the room. So it looks like we've got about, are we seeing the poll, Angelique? Does everybody see it, or am I the only one who's seeing it?
Everybody should be able to see it.
Okay, great. So we've got about 14% who are clinic leaders. We've got about 14% who are non-peer providers. We've got about 23% who you identify your main role as supervisor, 36% who are peer support specialists or advocates, and another 23% who answered as other. Now, I've always been curious, for those of you that are answering other than any of the top 4 that are there, if you could just in the chat say, I'm an other, and this is what I am, whether it's a combination of roles or what exactly inspired you to come to our inspiration series, I'd be very curious. So thank you for putting that in the chat. So as I mentioned at the very beginning, this is the first in a series of 3 webinars that we're offering this summer about what inspired people who were once receiving services in the adult mental health system to become peer support specialists, as well as those who've been inspired by peer specialists from the role of supervisor, trainer, or program manager. In our next webinars in the series, we'll hear from people who had experience in the child mental health system, and we'll be hearing from family peer advocates and youth peer advocates in those upcoming webinars. But the main thing we hope you will take away from today's webinar and those that follow is why peer support matters to mental health organizations and the difference it can make, not only to the people that come to the organization for those services, but also for those who work alongside the supervisors and the people that are in these unique roles. So I'd like to introduce you to our panelists for today. There will be a resource document also available of this webinar that contains their bios, but I'll just give you kind of an overview of who's going to be presenting today. So first we have Lene Brown. Lene is a nationally recognized peer training consultant and empowerment coach who formerly served as director of Howie the Harp Peer Advocacy Center. And if you're in New York, there's no way you have not heard of Howie the Harp Peer Advocacy Center. And it's been a center of excellence, largely due to Lene's wonderful work during the time that she was the director there. So Howie the Harp is a peer-run program dedicated to employment preparation for people in mental health recovery. And over a decade, Lene supported the development of the center and its peer training program by incorporating the experience and feedback from working peers, the people they support, as well as peer employers and supervisors. Lene now serves as a peer training consultant and empowerment coach. And you can learn more about Lene at her website, which is lenebrown.com altogether. And that information is also available in the resource guide that you'll be getting. Matthew McDonald is a program associate with Rutgers University, Academy of Peer Services, and PeerTech. Matthew is a New York certified peer specialist and a certified peer recovery peer advocate, or CERPA. He's been navigating a decade-long path towards recovery himself, and Matthew's lived experience provides him with necessary and profound insights into myriad systems of care as they exist in New York State. He previously worked as a certification coordinator for the New York Peer Specialist Certification Board, interacting with hundreds of certified and prospective peer specialists across New York. Next, we have Michaela Corazon, and she is the Outreach Center Coordinator at the Mental Health Association of Tompkins County, and she coordinates a center with space for a number of programs and services, including social activities and events, social drop-in hours, walk-in peer counseling for non-crisis situations, and community education and training. Prior to this work, she ran the Suicide Prevention and Crisis Services Crisis Line for Tompkins County for over 15 years, where she recruited, trained, and supervised peer crisis phone counselors. Prior to that, when she worked in San Francisco, she worked as a peer crisis counselor and advocate on the AIDS ward in San Francisco General Hospital, where she was part of an interdisciplinary team of physicians, nurses, social workers, and peer counselors. She also trained and supervised emotional and practical support volunteers working with people living with AIDS. And in the resource document, you'll see that there's an article that was written about Michaela's work that you can access. And finally, we have Yvette Patricia Pate. She is the National Association of Peer Supporter, or NAPS, Program Director for the Peer Specialist Workforce Advancement and Mentoring Network for New York State. Yvette is a certified peer specialist, certified peer specialist trainer, certified psych rehab practitioner, CPRP, and has a master's degree in human services. She has provided direct peer support, managed and supervised peer teams, and she's trained others to become certified peer specialists. And most recently, was the director of services for 7 peer-oriented mental health and substance abuse recovery-oriented programs, including mobile peer programs, recovery learning centers, which included a harm reduction component, a rapid rehousing housing program, and a community residential rehabilitation facility. As a result of her personal recovery, she has continuously dedicated the past 25 years of her life to empowering people to explore their career pathways as a result of their journey of recovery and wellness. She has served diverse populations, including women and children with substance abuse issues, and most recently, adults impacted by the co-occurring challenges of substance use and mental health challenges, as well as people living with intellectual disabilities. Yvette brings a strong sense of commitment and dedication to all of her endeavors. And so with that, I'm going to stop sharing my screen, and I'm going to begin by inviting Lene Brown to just talk a little bit about her experience. And Lene, let's start out by setting the stage. So why is this so important for clinics and mental health programs? What do peer specialists bring to the team?
Oh, I'm glad to start off this conversation. Thank you, Rita, for having me. I would say what peers bring is the lived experience, right? They've lived through what it means to recover from mental health. And so to add peers to the team provides a beacon of hope to program participants. They get to see someone on a regular basis who is recovering from mental health. And then also peers can bring a certain perspective when clinicians are thinking about programming and other ways to support program participants. So that experience, the kind of experience you can't get from a book and you can't get from studies, right? We know that lived experience is important. We know that lived experience can bring a certain aspect to anything that we want to offer. And I like to offer just like an analogy, if I might, because I say this analogy and people really usually tend to get this. So the analogy is the following. So my folks out there who are parents, think back before when you started having kids and you're going to have your first child and someone said to you, I could give you access to one of three groups of people to help you raise your child. The first group would be pediatricians, people who, world-renowned pediatricians, people who know about the health of a child that could help you raise a healthy, physically healthy child. But none of those pediatricians have children. The second group of people are child psychologists. They know everything about the emotional and mental health of children. They could help you raise a mentally well-adjusted child, but none of them have children. And then the third group of people are people who do have children, their parents. And they come from all walks of life, the postmen and teachers and maybe even unemployed, but they all are parents. Who would you be more compelled to speak to first? And when I ask that question live, a lot of people always say parents. And it's like, of course, why? It's because parents know, right? They know what it's like to actually have a child. They know what it's like to go through the process of that day-to-day with children. And here's the thing, just because you may want to have, to be with parents and talk to other parents, it doesn't negate the child psychologist. It doesn't negate the pediatricians, because when you're with your child and your child has a sore throat, you're not going to bring your child to your parent friend and say, my kid has a sore throat. You're going to bring your kid to the pediatrician, the person who knows about that. And so there is a place for lived experience. And so peers are bringing what I think is a missing conversation, a missing ingredient to a lot of clinical teams and to a lot of various programs and supporting program participants who are in mental health recovery. They're the hope. Peers are the hope.
Thank you, Lene. And I wanted to direct out to the audience, if you have responses or if you have like a response to who would you take your kids to, go ahead and put that in the chat, because we're going to come back to the chat and we're going to pull from the chat as we go forward with this conversation. And thank you, Lene. That's a great analogy for, what peers bring to the team, but what peers don't bring to the team. So thank you for that. So we'll come back to you again. We'll have you be part of a larger conversation, Lene. And again, for those of you in the audience, I know you can't chime in at this moment, but if you do have questions that come up while somebody's presenting or after somebody finishes their presentation, go ahead and put them in the chat and we'll revisit them during a time where we have all of the panelists coming together to answer your questions in the chat. So at this time, I'd like to invite Matthew McDonald to come forward.
Hi, Rita.
Hey, Matthew. So I understand that you once upon a time, long time ago, worked as a peer specialist. So what was it that inspired you to become a peer specialist?
Sure. So my recovery story was a long and drawn out one, which really was kind of capped at the end by a series of interactions with peer supporters. For the last 5 years of that disruptive time of my life, over the course of many hospitalizations, towards the end of that, I started interacting with peer specialists in an inpatient setting. And those peer specialists were reaching out to me from a local mental health association or Mental Health America affiliate. And I began to have conversations about the care that I was being offered through clinical teams with these peer specialists. I began to have conversations about some of the similarities in conversations that I had with different clinicians, some of the repetition that I experienced in their approach. And I also began to have some conversations with people about their own, meaning the peer specialists that I was working with, their approach to being creative about interacting with the care that they were being offered. So that included things like language, understanding what clinicians meant when they said something like non-compliant, and sorting through some of that harsh language with other peer specialists who had heard the same language. It included a conversation about medication. And I want to slow down a little bit right now and just say that, as far as a conversation about medication goes, peer specialists, it is not within the peer specialist role to make recommendations about medication whatsoever. But it's okay for a peer specialist to share their experiences interacting with care, interacting with clinicians, interacting with psychiatrists, and especially that element of self-advocacy and empowerment. So in my interactions with peer specialists, I found myself being continuously validated and empowered to advocate for myself in my conversations with clinicians in a way that allowed me to express my needs better. It allowed me to relate to the peer specialists as they were modeling recovery. And part of that modeling had to do with the care that they were actually interacting with in clinical environments. The introduction of peer specialists into clinics is exciting to me, not because they are an entirely separate service, but because the idea of peer specialists working on clinical teams means that there are going to be a lot of gaps that are bridged through these conversations. That was true for me, interacting with peer specialists while I was receiving clinical services. And I'm certainly hoping that through the advocacy and the education that Peer TAC is providing, along with technical assistance to the clinics and the clinic leaders, that these gaps are going to be bridged, and some silos can be taken down, and lived experience can sort of breathe true through these conversations in order to empower people to express their needs and find the care that they really need. So thank you, Rita.
Thank you, Matthew. And I mean, it sounds like you really benefited from, and what really turned the corner that made you want to become a peer specialist yourself?
Sure. So my initial experience working in any kind of peer capacity was in a drop-in center for the same Mental Health America affiliate that had been reaching out to myself and other people who were hospitalized in the local inpatient unit. And so the opportunity to recover socially and the opportunity to interact with other people who were truly role models for recovery for me happened in a volunteer capacity initially. And after a few months of volunteering in that capacity, I was asked to come on board as a peer specialist. I wanted to be able to give back to other people because I did see gaps, and I did see a reason for recovery modeling to be a part of the care that people received. After 5 years of hospitalizations, almost 15 involuntary hospitalizations over 5 years, the idea that speaking to someone about their own struggles, interacting with a system that has limited resources and sometimes limited time to offer the people that are navigating those systems, especially in inpatient units where you might interact with a psychiatrist for 15 or 20 minutes a few times a week. To have conversations with peer specialists who are saying, this is how I got the conversation that I needed to have. I wanted to give that back to other people. I wanted to empower people to ask for what they needed in an environment that can kind of pass you by in a sense. And eventually I went on to provide crisis services as well. I worked in a crisis respite for a couple of years, and in that capacity, I was able to really tap into some of the unique empathy that I had for people as they were existing in a crisis state, or as they were in an active state of mania or psychosis, which I had experienced to an extensive level in the past, and was able to offer a unique sort of empathy, in that in those situations and under those circumstances. I was able to offer my perspective on body language and patterns of language, for example, and how to connect with someone who may find or who clinicians may find it difficult to connect with because of a state of mind that seems otherwise inaccessible. So the idea that I had something unique to offer, Rita, and the idea that I saw gaps in care were both the primary reasons that I got involved as a peer specialist.
Thank you so much, Matthew. I'm sure people are really going to start to understand both what you get and what you give, what you give and what you get. So thank you. So next I'd like to invite Michaela. And I know that you have been doing supervision sort of in not directly to Matthew, but he's watched your supervision style from afar and admired it a lot. So what does supervising peer specialist actually look like? What are the things that you do to support and supervise the peer specialists?
Well, first and foremost, I am a peer specialist. I'm a person with lived experience. And I also have, 4 decades of working in peer services and have learned so much about how to be a good peer specialist from my mentors, the people who have taught me how to offer respect, mutual consideration, how to teach in a way that is empowering and not patronizing, who have taught me about my own wellness and self-care. I'm a person in recovery from mental health issues, as well as substance abuse issues, as well as someone with chronic suicidal thinking. So it's not a mistake that I worked on the suicide prevention crisis line for over 15 years, because part of that was about, my own recovery and learning special skills to be successful in my recovery. So as the leader of this team at the Outreach Center, I'm very conscious, I'm very respectful of my team, because all of them have really specialized lived experiences, and I watch them in their own recovery. And I, from that perspective, because I have to teach people how to have boundaries, because we are human beings working with other human beings with similar experiences or lived experiences. And so how do we stay human and stay real with our guests, but also maintain very important boundaries, because it's up to us to maintain the boundaries, right? And why boundaries are important. We're going to have a whole session on that. But also how to encourage my team, how to ask them, well, how to suggest, would you like more training in this? So, allowing them to take some time off to go off-site or to do trainings online to help them feel more confident in terms of improving their skills. We have some relatively younger peer specialists who want to facilitate support groups, and they need help in learning how to do facilitation. So I can do that because I've been a facilitator of groups for 40 years, but also to do it in a mentoring way, in a non patronistic way or ageist way. Because I'm also realizing that I'm also training the next generation of peer workers. And so that's my job. My job is to create a safe environment, but an environment that has boundaries, a safe and creative environment so that we can learn more. We're always wanting to learn more. To provide constructive feedback regularly, which I actually check in with my team before every shift, before we open the center. And ask them what it is they need support with. And I see peer supervision as a good opportunity for more experienced peer staff to provide support and valuable on-the-job experience to more junior staff. That's how I learned. I learned from the people who came before me, a lot of whom are not on the planet anymore. But sometimes I hear them when I say something, I'm imparting wisdom that I got from them, paying it forward. And that's all I can think of right now. Are there other questions, Rita?
Not for now, but we'll have you come back and help answer the questions as we get them in from the chat or some others that we have. So thank you, Mika, very, very much.
Thank you so much.
And so now I'd like to invite Yvette to join us. And there's many things, because I know your background is all of those, and so I'd like to invite you to tell us a little bit about what does a professional association mean, not just for the peer specialists, but importantly for the mental health programs, the providers, the organizations. How does it help them?
Great question, Rita, and I want to thank you for having me here today. I also want to thank my panel members. What a great, powerful group of individuals with such amazing things to share with the group. And thank everyone who is here joining us today. One of the great things that I believe is beneficial is that when you join when you're a part of a professional organization such as NAPS, as a professional or mental health provider, you have an opportunity to tap into a wealth of resources, not just for yourself, but also for those that you supervise, for your agency in general. You have opportunities to access networking. You can connect with other members. I think peer support transcends all areas of life. So if you're a professional working in any field, you like to connect with others who have that same experience. You want to know that somebody out there can have an answer to you, or just be there to walk you through something if you're struggling with a situation, or you got a new person you're supervising and they're seeking certain resources, or you need resources for them. So there's networking for both the supervisors, the agencies, as well as the peer specialists themselves. There's the online resources. You have access to conferences. You can get discounted registration through membership, which is a great thing. You can also get discounted CEU, continuing education units, through membership. There's the opportunity to stay up to date on the latest trends in the field of peer support, especially with NAPS. You can also boost your profile. Being a member of different organizations helps to boost your profile as well. So there are so many, and I invite everyone to visit peersupportworks.org to check out our website, which is still in development. We're going to be constantly adding new and updated resources. And it brings about a sense of community. Everyone likes to feel a part of, so we want people to feel a part of. We want them to know that we don't endorse any particular, as NAPS, we don't endorse any particular state, but we are about the nation, and wanting to be focused on helping people throughout the nation. And as it relates to the peer workforce advancement for the state of New York, I'm very excited about what we're going to be bringing to that experience, to have an opportunity to connect with peers as well as agencies and supervisors throughout the state of New York and be a central hub for them. And I think that people will find that it will be very beneficial for professional and personal gains and goals that they may have for themselves. So that's pretty much what I have for that particular section.
Thank you so much, Yvette. So, as Angelique has encouraged you, please feel free to chat in your questions. Either at this point, anything that you can think of that any one of the four of our, or all four of our panelists can present on. And I'll just throw a question out to all four of you. You can all come on camera. We'll all kind of look at how we might answer this question. But the first one is, what is the most important thing that a mental health program can do to create a culture for peer support specialists to be successful?
I'll take that. One of the most important things that they can do is join an association, so they get to know more about what that involves. And to understand that peer support specialists, we're professionals just like anyone else. We want to be respected. We want to be a part of the team. We don't want to be in place of anything or anyone. We want to bring our special, unique gifts to the table based on our lived experience. But we are also aspiring professionals. We seek opportunities to be a part of advancement. And many of us have other credentials and levels of education. So we want to be honored for what we bring to the table. We want to be respected as professionals. I believe myself, I'll speak in my own terms, I didn't ever want any special privileges or opportunities. I wanted to work hard to gain and get all of the opportunities that were afforded to me. And we are very, very committed. And our peers who we work with, they love us. They enjoy knowing that we are someone that they can look to and say, hey, I was where you were at some point, and I can aspire to go higher in my life if I choose to, or I can be the best person I am, planted and rooted right here where I am. So one of the wonderful things that you can do in embracing peer specialists in your programs is just that: embrace them, respect them, and know that they will bring something of value to your agency, to your team, and most importantly, to those that you serve.
Thank you. Anyone else on creating a culture?
I would add, what's really helpful is that as an employer, you have a vision for your peers and what you'd like them, how you like them to support your participants. Have a very clear vision, job description, so that when your peers come to work, they know exactly what they're responsible for. They know exactly what a good job looks like, that they have strong supervision to support them in doing the work that you hired them to do. That clarity makes all the difference in the world.
I'd like to piggyback at what Yvette and Lene said. And I think, as with any, if you're going to employ somebody who's a peer, and if you don't know what that means, you have to learn. Because peer specialist is jargon. It doesn't mean anything to anybody who doesn't understand it or hasn't lived it. So they have to educate themselves. It's like diversifying a workspace. You really have to know about the different diversities, whether it's race or gender or sexual orientation, etc. So the responsibility does fall on people to teach themselves or figure out or read about what peer specialists do, and the history of the peer specialist movement too.
And I would jump in and say, I agree with what Mika said earlier, as well as what Yvette said earlier, in terms of providing opportunities for peer specialists to seek further training, to expand their continuing education, but also to network with other peer specialists. I know what it's like to be a peer specialist in an environment which is social to other working peer specialists, but I also know what it's like to be a peer specialist working for an organization where there's very few peer specialists and mostly human services professionals or clinicians on staff. And those are two very different environments. And I think if a person is in an environment where they don't have the support of other people who identify as having lived experience, who identify as having trained as a peer specialist or worked as a peer specialist, and it's a different experience. You know, human services professionals and so often clinicians are taught to intentionally disclose their own life or lived experience or living experience if they are confident that it will benefit the client in those settings, right? Whereas a peer specialist, it may be earlier in the conversation and more freely offered that a person would be sharing their lived experience. And so with that uniqueness, I would just say that it's important for peer specialists to be able to network and develop their own storytelling and lived experience sharing abilities by interacting with other people who are navigating that conversation, which is inherently different than interacting with a clinician. Or excuse me, which is inherently different than a clinician interacting with a client in so many ways. And the last thing that I would say is that it takes legwork. It takes work for a clinician to become familiar with the demands and the differences between what clinical work looks like and what peer specialist work looks like. And it's really important, as Mika said, for a clinician to become familiar with the specifics, not to just generally say we want people's voice to be raised up with lived experience, but talk about the nuances of sharing one's own story, to talk about the skills that are actually involved. And there's still, I also want to emphasize that there's still an element of intentional disclosure where you're always kind of orienting yourself around disclosing and sharing your own lived experience for the benefit of another person. It's not just for the sake of telling one's own story, but it's different in terms of the availability of the story and the frequency possibly at which one's story is told.
Thank you, Matthew. So Amber, do we have anything in the chat before we go on?
I haven't seen anything on the chat other than Tim asking us if we could give 3 examples of where empathy or other skills were used as a supervisor or peer specialist.
Sounds like a good question. Anyone want to take that? Thanks, Amber.
I'll take it. Empathy means to feel with. And most of us are naturally empathic. Those of us who have gone through our own process and are in recovery. And so when I am sitting down when I've done it recently, because some of my people have had some challenges on the job, empathy means that I listen. I ask and I say, tell me what's going on, or how was that for you? Or when this happened, what did you want to do? What did you do? I have to learn more about their motivation for what they chose to do or what their decisions were. And then from that place, I can say, well, let's look at different options that we could have had or could have chosen. So yeah, of course I'm going to feel it. And I'm such an empath that I walk into the room with my people and I can instantly tell when something's up because I know them, and I can tell by body language or just the things that they're saying or how they look. So I use empathy every day because my job is to keep my team cohesive and healthy and happy. And how do I do that? Empathy is a tool, but it's a very essential one.
I would like to jump in that one as well. In regards to an example of actually being a supervisor and providing that positive impact on someone's life, I've had a number of occasions where peers that I supervise have come to me with a lot of frustration. They're frustrated because they can see so clearly what a peer that they're working with could or should be doing.
Right.
And we are so empathetic when we're working with individuals because we're just that, we have that level of connection. And because we've had similar experiences and we know that there is a solution, sometimes we can over-identify and say, hey, you can do this. But if that person hasn't arrived at that place, how do I, as a supervisor, support the peer, the professional, in understanding that they are doing exactly what they should be doing in supporting their peer by literally meeting them where they're at, holding that hope for them, and knowing that at some point in that journey, if they continue to walk with them, they will be successful, but only if they choose to be. You can walk with them, but you cannot predict the outcome. You can give them examples, you can give them resources. And what I try to say to them in those situations in supervision, because supervision is very important. That is the place where a peer comes to be able to vent about their experiences. They come to be able to get resources and encouragement and support for themselves. Because if you're the source and you're pouring out into your peers in the community, you definitely need to have a place where you can replenish yourself. And oftentimes that's either with your own peer networking or in your supervision. So I've had peers come in and have those experiences, and I just ask them very simply, do you feel that you're providing the best level of peer support that you can provide to that individual? Are you providing them with the resources that are available to them? And can you literally take yourself out of the equation and understand that just like you had a journey to get where you are in your recovery, they too have a journey, they too have a choice. So we walk with them and we allow them to stumble where they may, and let them know that no matter what stumbles they may or may not have, that we do recover. And there are opportunities still for them to continue to move forward. And that when you are pouring out in that way, you don't have control over the outcome. You're the professional, you're there to walk with them. You're there to maintain a certain level of boundaries. You share your story to inspire, not to vent, and to let individuals know that whatever they choose, it is possible for them, and you'll be there with them.
Beautiful. So I have another question that I'm afraid this might go directly to Yvette, but I'd like to have her hold off on answering it and allow everybody else to, because she'll have a lot to say about this one. Where and how can organizational leaders and operations, mental health operations staff, learn more about peer support values and practices? Anyone?
I would definitely start with your state certification, because most states in the United States do have certification and they do have standards. So I would definitely start with that. Looking at the exams, looking at the resources they offer as well, because they're going to point you in other directions as well about what's available in your state.
I agree. Becoming familiar with the training that peer specialists are taking in order to become certified, as well as the training that's available around the topic of supervision, can be especially important for mental health providers, people organizing programs, people providing direct supervision to peer specialists to become familiar with. And I will add a plug in that respect to a series of courses that I worked with many subject matter experts around New York State to develop in my capacity at the Academy of Peer Services, which is the supervision specialization track. We have recently developed a series of 10 hours of coursework, or 5 2-hour courses around the topic of peer supervision specifically. And there's a lot of talk in that series about the intersection of clinical support with peer support, the intersection of medical model oriented services with the tradition of peer support services. And so while those trainings are not explicitly, at least at this time, able to be used as CEs for clinicians, and there's an aspiration to do that, just to be clear. While those trainings are not explicitly CEs for clinicians, it is certainly a way to become more intimately familiar with the conversations that peer specialists are having, because we do our best at the Academy of Peer Services to create trainings that are inspired by the living conversations that exist as an extension of the peer movement and peer services all over New York State. So thank you.
Mika, did
Rita,
you? Oh, sorry.
I'm sorry, read first.
Mika, did you have anything to add?
No, I just want to put a plug in for the supervision track that Matthew was just talking about. I just finished it, and it's excellent.
And before we go to Yvette, I'm going to put in a plug for the peer-run organizations around the state, because there are many, many peer-run, many peer staff. There's an incredibly powerful training program in New York City called Howie the Harp Advocacy Center that will provide, much information about what's the core foundation of where did this come from anyway. And we don't want to lose the heart of the advocacy that goes with that. So much of the peer-run organizations, of course, are still practicing the purer form. I want to call it the purer form of peer support, because it's the business of those organizations to provide mutual self-help. When we start moving out to mental health organizations, we've lost that. This is the business of the organization, to the business of the organization is to treat, which is, a perfectly fine, business model, but it doesn't necessarily lend itself as easily to that mutual self-help that happens in the peer-run organizations. And now I'll hand it over to you, Yvette.
You know what, Rita, I'm going to ask you to go ahead and repeat that question for me. Would you repeat that question for me,
So
please?
where and how can organizational leaders and the operations staff of mental health organizations learn more about peer support values and practices?
Excellent question. And all of the answers that my co-panelists said were amazing, and they just did a wonderful job of sharing those resources. Of course, I'm going to be a shameless plug for NAPS. You can always come to our website. You can reach out to me directly. I think that everything that was shared was excellent. I'm going to say something synonymous with gatekeepers. We are those who are wanting to ensure that the continuity and the integrity of peer support remains intact. And we do everything within our power and in our knowledge to assert that and ensure that we are available to those who are also advocates and those who want to expand or explore more avenues and resources for themselves or for their agencies. One of the things that as a supervisor that I've often done is I've invited the peer specialists themselves to bring in the resources that they were trained in and go back and revisit some of those components. Every state, as one of my co-panelists mentioned, has their peer specialist training. Delve into that, bring that into your supervision so that you can get a sense of what they're learning, what they learned. I've had individuals when I was training as a peer specialist supervisor come in and kind of observe a class in areas where they were invited to come in and somewhat audit a class, get to know exactly what they are learning so that they understand the nuances of what they're being taught and the boundaries that are implemented and for them to learn to maintain and establish when they're working with peers. But being a part of a network, a community, all of the things that I mentioned in answering the question about what's the good thing about professionals being a part of an organization such as NAPS is going to be one of your greatest resources, tapping into that and really having that true curiosity, that spirit of, I really believe in this. or I'm still on the fence about this, but I'm open. You know, come on and look into these things. Talk to people who, like the panelists here, who've been there, done that, and are still wanting to continue to push forward this movement in such a way that keeps it strong, keeps it thriving, and keeps everyone understanding that we all play a part in the quality of what we provide to those they serve. At the end of the day, it is about those who we provide services to, most importantly, that they get the best of what we have to offer them. And if we're invested in that, we're going to do everything within our power to learn and know and grow into those areas that may not be our strengths. You know, I make it my business to know what my strengths are and what those areas are that I need to enhance. And I make it my business to not make excuses for the areas that I need to enhance. I tap into the resources that are available to me. I look into others who are doing what I want to be doing or what I want to do better. And I acknowledge that there are places outside of my knowledge and awareness that can enhance what I'm doing and how I'm doing it.
Thank you so much, Yvette, and thank you all. At this point, I'm gonna, bring us back into, we're gonna start wrapping up, but if there are any questions that remain in the chat, we'll try to get to them at the very end. I'm gonna go ahead and go through our wrap up right now. Okay, so one thing that I wanted to share was that NAPS has national practice guidelines for peer specialists and supervisors, and this is a really good source of information for, especially for organizations that are not familiar with what the core values of peer support are. I could say a lot about where these came from, but I'll just suffice to say that I was very involved in the development of the first iteration, somewhat involved in the second iteration, and pretty involved in this next resource that NAPS has to offer. And that is a book that my colleagues, Gita Enders, Dr. Joanne Forbes, and Jonathan Edwards, we worked with contributors from over 40 peer leaders who had given presentations at the NAPS, National Association of Peer Supporters annual conference. For over 5 years, we looked at over 5 years, the conference presenters, and we invited them to contribute. Each of them contributed, anywhere from 3 to 5 pages on what they had presented on, and it became kind of a compilation of best practices and just wisdom from people that are out there doing peer support training right now. And that is available for purchase on Amazon. You can either get it as an ebook or a Kindle edition, or you can get a hard copy. But for organizations that are really trying to understand what peer support is, I think it's a really great resource. And not just because I was part of the development of it, but because it really has a lot of wisdom from many, 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 many people who contributed. I don't know, Yvette or Angelique, if you have the link ready, but if you are a leader for a motors clinic, we're doing a survey, and this has been going on for a while. You may have already responded to this, but if you haven't, we're really interested in your information about where you're at in the development of peer support services, the kinds of training that you're delivering. Just it's a survey of what you're providing and what you're planning, and how ready you are for including peer support services in your program. Some of our upcoming Peer Tech events, we have this Inspiration series that we're offering. We have some live regional seminars coming up in July and August, and I'll share a little bit more about that. In September through November, we'll have some learning collaboratives that are based on what we're calling our organizational self-assessment for organizations to see how ready they are to include peer services. And then we have 4 foundational webinars that we've already done once that we'll be repeating in July and January through April. Our upcoming live events are going to be July 26th in New York City, August 2nd in Long Island, August 8th in Albany, August 15th in Syracuse, and August 23rd in Buffalo. And these are primarily for the mental health, outpatient treatment and rehabilitation services, the clinics, the operational staff, the leadership, the non-peer staff to really come and learn more about how to include peer support services in their settings. Again, this session has been recorded. In about a week, this will be available out on our PeerTech website, www.peertech.org. If you're looking for continuing education and you're an adult New York certified peer specialist, this recording will be converted into an online course that will be available through the Academy of Peer Services, very likely in the fall of this year. And if you're a youth peer advocate or a family peer advocate, you can just save the email that you received when you registered for this and submit that with your renewal application to obtain continuing education credit. Here's a little bit about how to contact us, our website, our email address. We have a listserv, so you can join the listserv either through the link there or through the QR code. We do develop resources for each one of these webinars, and we have a frequently asked questions list, and we have the resources which will have all of the bios for each of our 4 presenters today, as well as some other resources related to peer support services. And there is an update coming to the OMH guidance on peer support services. We just found out today that the guidance is going to be out this week, so that's really good news, and we'll be sharing that update with you, with folks shortly. And so with that, I'd like to say thank you, and especially I'd like to thank our panelists, Lene, Matthew, Mika, Yvette, all 4 of you for an outstanding hour of inspirational wisdom. I'd also like to thank Amy Spagnolo, Marie Vogel, and Matthew McDonald on our Rutgers Academy of Peer Services team. I'd like to thank Angelique Rodriguez, Amber Martinez, Connor McCollum, Lydia Franco, and Andy Cleek, who are our PeerTech partners, and my co-director, Yvette Kelly, with the McSilver Institute, for all of the collaborative efforts that have gone into this whole program for PeerTech. And I really want to give a special shout out in particular to Angelique, who does so many of the things behind the scenes, from handling all of the promotion, to handling the registration, to handling the people who are having emergency issues with their registration. I just really want to give a shout out because that's often not something that's acknowledged, but she does so much work behind the scenes, and we couldn't be successful without somebody as dedicated as she is there. And I'd also like to thank our amazing sponsors at the Office of Mental Health, Liz Breyer, Amanda Sake, Jolie Lloyd, Amy Smith, Dorota Kearney, Jane Miner, Catherine Merrill, Meredith Ray Labat, Shannon Fortran, Sharon Carson, Stacy Hale, and Linda Riley, who also is one of the unsung heroes behind the scene, and all of the regional and statewide advocacy specialists that are part of the Office of Advocacy and Peer Support Specialists. And for me, I just want to give a very special thank you to Celia Brown. May she rest in power. We miss you. And of course, all of you for attending today's presentation. Thank you very much. So the
Great job, Rita.
So the Peer Support Services Technical Assistance Center, PeerTech, is a partnership between McSilver Institute for Poverty Policy and Research at the New York University and the Academy of Peer Services at Rutgers, the State University of New Jersey, with generous funding from the New York State Office of Mental Health. For more, you can go to our website, peertech.org, and we hope you will. Thank you so much, everybody.